to see postoperative fever. Here the mnemonic is with the 4 W's. The first would be of wind. This includes the pneumonia and atelectasis. Then water. This usually would be urinary infection or just urinary retention. This is the second W. Then for wound infection, and the last W is for weird things like drugs, like hyperthermia, maligna, or things like that are very weird. So first, in the wind, this occurs in the first 1 to 2 days for the atelectasis. Here, the patient has most of the time a compressive atelectasis. So the patient presents with difficulty breathing, usually 1 to 2 days after the surgery. The patient would develop cough, hypoxia. The diagnosis would be done with oximeter, a chest X-ray that would look a whitish area, that is the atelectasis. The treatment would be the lung toilet. This means you can do either just things like cough, deep breathing, and ambulate. The other is the insensitive spirometry. Here is like a positive inspiratory pressure, similar to this. And we can also do it with a tip, but here the straw, but this is like more not fun. 3, the physical therapy or chest therapy. And the 4, the last thing that we would do would be a spirometry, a bronchoscopy. The pneumonia is a complication of atelectasis, and this presents like on the 3 to 5th day most of the time. Between 1 and 5 days, most of the time would be 1 to 2 days. And here the diagnosis would be with blood cultures, etc. Or sputum cultures. And the empiric treatment would be piperacillin, tazobactam, and vancomycin, for example, something like that. The only way in which we're going to give antibiotics is with pneumonia, not with atelectasis. Water. The urinary retention can cause fever. The urinary retention is twofold. One is because the drugs that are given have anticholinergic effect, and the other is because because after the surgery, for example, of the abdomen or things like that, when the patient is doing vascular maneuver, this can be uncomfortable, so they don't do it completely, and so they empty completely the bladder. The wound infection, we have this is 3 to 5 days. Wound infection is like in more than 7 days. Oh, and I forgot one, that is the deep vein thrombosis. Deep vein thrombosis that after can lead to pulmonary embolism, but only on the deep vein thrombosis, the patient will feel like, a red leg, swollen, painful sometimes. The diagnosis of pulmonary embolism will be the patient has respiratory distress, hyperventilation. When we suspect this, most of the time it's about 5 to 7 days, but we should suspect it in any time. And when we suspect this, it's immediately the CT scan with large IV contrast. Here we are not going to do the fibrinogen, nothing like that. Unless the patient has contraindication to contrast, like patient with renal failure, then we can begin with the ultrasound scan. Not the ultrasound, the VQ scan. We should also remove all the IV lines. We should treat it with heparin and then warfarin, things like that. And only we will put the IVC filter if the patient has contraindication to thrombolysis, to thrombolytic agents. Now for the wound infection, these usually occur on the postoperative day 7, and the deep abscess, this occurs from 10 to 15 days, and here also some other weird things. Whenever we suspect the wound infection, this is because the patient would have fluctuance, so we will feed fluctuance. The tissue will be fluctuant. This is like equivalent to sepsis, and this needs drainage, surgical drainage. If the patient just has tenderness, looks red, something like that, this could be cellulitis, something like that. But if it is fluctuant, then it is a abscess, and this is very, very bad. So we need to be very conscious about this. And if there is doubt, we need to do the CT scan or ultrasound to assess it. So if there is doubt, no doubt to do the CT scan. And even though we don't find anything here, we should always be considering that maybe the patient has a occult abscess. This includes a subdiaphragmatic abscess, or subphrenic, or subhepatic abscess. If there is only cellulitis, we will just give antibiotics. And the most common bacteria that can cause this is Clostridium, Clostridium difficile, and Clostridium gangrene, Clostridium perfringens, that would cause the gangrene, and Streptococcus pyogenes. These are the most common causes of cellulitis. For other things, we will consider hyperthermia maligna, that is just the abnormality on the dihydropyridine receptors for calcium, or channels for calcium. Then we just need to coat the patient with blankets or water or ice. The patient would have hyperkalemia, hypercalcemia, myoglobinuria, etc. But so the algorithm is like 1 to 2 days with healing wound, like pneumonia or atelectasis. Water is like 3 to 5 days, that would be urinary retention. 7-day deep vein thrombosis, and wound infections, Clostridium, Streptococcus pyogenes, and for 10 to 15 days the abscess.